I don't think I need to convince you how important sleep is. Just have one bad night of sleep and you feel it so acutely. Sleep is a very important basic physiologic function of human beings. And as nurses, we need to understand what we can do to facilitate good sleep, especially in our hospitalized patients. So today we're going to be completing our concept of sleep. You're going to be using Giddens chapter 11 and Davis chapter 34 as you go through this work with me today. And as we study along together, you'll be completing study guide concept guide B. And then we'll be talking about defining and describing this concept of sleep, talking about risk factors, what signs and symptoms might we notice, and what are the appropriate collaborative interventions to promote healthy sleep habits. So in terms of the definition, sleep is a natural, necessary process that involves a shift both physiologically and neurologically in activity and really is intended to be restorative. Sleep is not just a period of inactivity, but it restores both the mind and the body to be refreshed and rejuvenated. But before we get too much further with this concept, I'd like you to watch a short 5-minute video that really introduces you to this concept and why sleep is important and what it does for our bodies. So go ahead and pause here, click on the link below in the description box, and I'll see you back here after it's done. In terms of the scope of sleep, of this concept of sleep, the goal is restorative sleep. And then in between, you can have an intermittent or situational poor sleep. Maybe you had a fussy toddler who was up with a cold overnight, or you pulled an all-nighter studying for a nursing test, but it's just intermittent and it affects you once in a while and you get over it. And then the poorest outcome or the worst part of the scope is chronic poor sleep or some kind of sleep disorder that really has long and sustained problems for patients. Now, your Giddens text and Davis both talk about the sleep cycles, which were really well addressed in that TED Talk, so we're going to keep moving. Now, interestingly, depending on your age, you actually need a different amount of sleep. So infants sleep most of their day, 14 to 16 hours each day, and toddlers 9 to 10 hours, school-age children somewhere between 9 and 11 hours. Teenagers tend to need about 9 hours of sleep and tend to actually do better when they stay up a little later and sleep in a little bit more. It just happens to be that way with their circadian rhythm. And adults tend to need between 7 and 9 hours on average, but everyone kind of knows where their sweet spot is and when you wake up and feel refreshed. Let's talk a little bit about sleep disorders. Now, primary sleep disorders are those that are their own problem. They just exist as an independent condition. And secondary sleep disorders are often caused by underlying medical conditions, mental health issues, or side effects from medical treatments. For example, a patient who's on Lasix, a diuretic, and where it's making them go urinate more and maybe even get up in the middle of the night to urinate. That's going to have impact on sleep cycles. So different medical conditions can impact sleep. Other things like anxiety can keep people up and have them face things like insomnia. There's a link down and below on another video that talks a little bit more about sleep disorders in general. So here's some examples of common sleep disorders. Insomnia, just the inability to fall or remain asleep, or even to go back to sleep if they wake up. Circadian disorders, there's an abnormality in their sleep and wake times. This can happen if you're jet lagged and you travel internationally, or if you work night shifts. And for most of us who start off as nurses, we work a night shift or two in our early career, and it can have an impact on your circadian rhythms. Restless leg syndrome, where their leg just literally won't stop shaking, and it can really cause disruption in being able to get to sleep or stay asleep. And then hypersomnia, excessive sleeping, especially during the daytime. And oftentimes we're going to see this related to mental health disorders, specifically with depression. Sleep apnea is one of our featured exemplars this week. It's when a patient has periodic apnea, meaning not breathing, for at least 10 seconds during their sleep time. Narcolepsy is when you kind of are sleeping during the day without being able to control when that happens. And then parasomnias. Parasomnias include a variety of sleeping disorders, things like sleepwalking or sleep talking, bruxism, when people grind their teeth at night, having night terrors, which is like a nightmare on steroids, Having REM, sleep behavior disturbances, where they actually are up and about during their REM cycle rather than kind of paralyzed by their body as they should be when they're in REM, or enuresis, meaning urinating at night. And oftentimes we'll see this in our young children, and it can be a problem up into even the middle elementary age if they're having delayed control of their bladder overnight. So the consequences of poor sleep over a long period of time are actually pretty significant. And this is why we need to make sure our patients are getting adequate and good quality sleep. So the consequences of poor sleep over time cause a lot of stress on the body. And you're going to see this manifest as things like heart disease and heart failure, hypertension and stroke, obesity, developmental disorders such as problems with growth hormones, reproductive disorders, and even increased mortality. And the challenge with some of these consequences is patients can get stuck in this cycle where the things that would make them get better sleep are the same things that are becoming the consequences of poor sleep. So they get a poor sleep and lack of rest, which means that they're having a hard time dealing with their coping, which means that they're increased in illness, and then they have more illness, which then gives them more pain, and then they have more sleep, poor sleep and lack of rest, and the cycle continues. And so it's really hard to break the cycle, especially when it comes to weight management and immune function. So let's talk about the risk factors that place individuals at risk for having sleep problems. Really, anybody is at risk for having sleep problems, but more commonly, we're going to see this with the middle-aged and older adults who have problems with sleep. Women and pregnant and perimenopausal women often have sleep problems. Men are going to be the ones who have the highest risk for sleep apnea, and obesity also puts you at higher risk for sleep issues. So what is it going to look like if someone's having problems with sleep? Well, typically it's first going to come with a self-report from the patient that they're having a sleep problem. And you'll need to do a thorough review of all of their body assessments to really identify what the underlying problem is. A family history and a social history are a helpful place to start. And in terms of physical examination, there are a few physical examinations that can indicate a sleep disorder. Something called the Mallampati score, which just really means if they say ah and they open their mouth, does it look nice and wide or does it look more constricted? Their neck circumference, the wider their neck, the more likely that they're going to have obstruction of their breathing at night and have a resulting sleep apnea. Their weight and their BMI. Respiratory and cardiac functions can all indicate risk for things like sleep apnea. And any neurologic changes could also cue you into the fact that they're having sleep issues. So we're going to be asking the patient about their sleep patterns and rituals, bedtime rituals, what their environment's like when they sleep. Do they have the TV on or do they keep it quiet? Do they use a white noise machine? What kind of sleep aids do they use? Do they use Benadryl to help them sleep, or melatonin, a natural sleep aid? And have they had any sleep problems or changes recently? There are a few diagnostic tests that are helpful for identifying sleep problems. Sleep studies can be done in sleep clinics where patients get hooked up to all sorts of different monitors for a 12-hour period overnight, and they're monitored for their sleep and risk for sleep apnea. And patients can also take sleep journals where they really record the amount of sleep and the quality of sleep and how they feel when they wake up. And all of that information can give providers good information about what's going on with them. So let's talk briefly about some of the nursing and collaborative interventions for optimizing patient sleep. So first of all, always, is primary prevention. How do we prevent sleep problems from occurring in the first place? And really, prevention is going to focus on good sleep hygiene, having an environment that's conducive to sleep, having a bedtime ritual, making sure you're reviewing personal behaviors, like is your patient consuming caffeine right before they go to bed, or are they on their devices right before their bed, which kind of gets them more energized and alert. Being consistent with bedtime and awakening times puts them on a good natural circadian rhythm. Practicing good dietary habits and regular exercise makes you more tired and ready to go to bed at night. In terms of screening for sleep issues, we're really talking about screening for things like sleep apnea and bruxism. Bruxism is when you're grinding your teeth at night and it's often caused by a dental issue called TMJ. And sleep apnea, again, is when patients stop breathing for periods of time overnight. And they would not notice this, but there are some physiologic changes, things like hypertension that can happen that cause patients to kind of be alerted to the fact that they may have sleep apnea problems that would qualify for a sleep study. So, really, secondary prevention, screening tools, really for sleep, focus the majority of the time around sleep apnea and bruxism. Now, we really need to think about nursing interventions as it relates to hospitalized patients. It is very hard to sleep in the hospital. If you've ever been hospitalized yourself or had a loved one who was hospitalized, I'm sure you can understand how difficult it is. You've got alarms and bells and whistles and people coming in at all hours of the day and night into the room. And sometimes you have a roommate. It's a really difficult place to get rest, which is kind of ironic, isn't it? Because the people who need rest the most are going to be our inpatient hospitalized patients. But there's things that we can do to make our patients more comfortable. A lot of times, units will have signs on the unit that say quiet at night or a good night's sleep starts now. And they'll even make announcements over the loudspeaker saying, this hospital wishes all patients a quiet night, kind of as a reminder to the staff who is up all night to be quiet in the hallways and to allow patients to rest. So you want to do things like clustering and scheduling nursing care to avoid interrupting sleep whenever possible. Making sure you can create a comfortable and restful environment, encouraging patients to maybe pop on a white noise app or something that's comforting to them on their phone to promote comfort and relaxation, making sure they have the pillows that they want, and help support bedtime rituals and routine like brushing their teeth, washing their face, things that help get them ready for bed that would be something that would be familiar to them. You can also talk about offering foods that help promote sleep. Maybe a cup of tea at night can be very calming. And then teach about good sleep hygiene. Go ahead and pause here and take a look on Davis, page 914. There's a really nice self-care box, which is great about patient teaching on how to promote good sleep hygiene. So pause here and come back when you're done reading that. Now, there are a number of pharmacologic agents, medications that are used to help promote sleep in patients who have sleep disorders. And if you look with me on page 99 of your Giddens text, in box 11.1, there's a really nice list here of different common pharmacologic agents used to help treat sleep disorders. Things like anticonvulsants, antidepressants, antihistamines, benzodiazepines. We've seen those before when we talked about anxiety, remember? And then even melatonin, which is a natural hormone that's released by the body at night that can help promote sleep as well. So take a look at this list here. Some of the drugs may be something familiar to you. Benadryl we use for allergies, but it's also sedating. Same thing with our benzodiazepines. They are used for anxiety, but they also have a sedative effect. And then the benzoreceptor-like agents, you might have seen these on a commercial, Sonata, Lunesta, Ambien. They're all made as specifically as sleeping pills for patients who really have a hard time sleeping. So these are all different agents that we can use. There are drugs. We always prefer non-pharmacologic sleep hygiene methods first to really promote healthy sleep habits, but there is a place for pharmacologic agents as necessary. Now, there are a number of interrelated concepts you'll see here for the concept of sleep. Certainly, fatigue and sleep are very interconnected, as is stress and elimination or pain, because those all affect getting good sleep. Cognition, gas exchange, and perfusion, all of these underlying medical conditions that can impact the quality of someone's sleep, and hormonal regulation, because it's the hormones of the body that change in order to promote good sleep cycles. So you'll see all of these really do interrelate a lot with our concept of sleep. Finally, there's a number of featured exemplars, and I didn't highlight any of them because, quite frankly, we're kind of talking about all of them as we're talking about fundamental sleep disorders and sleep apnea. And I would encourage you to take a look at the example problem on Davis page 906 to 908 that really lays out the understanding and the foundation when you're talking about sleep apnea. So go ahead and read through all of these exemplars in your Giddens text, and then head over to Davis and use that sleep apnea sample problem on 906 to complete your exemplar worksheet for this week. Well, I hope this lesson has given you some information about the concept of sleep and also maybe inspired you to make some different changes in your sleep habits to promote good sleep and well-being for you, knowing that it's not only about feeling rested in the morning, but that chronic sleep problems can have a devastating physiologic consequences on our bodies, and we want to promote good health, and that starts with getting a good night's sleep. I hope you're rested, and I'll see you soon.